Hi, I'm Dr. Gary Domby, and you're about to learn the basics of one of the most important systems to ever be created, applied kinesiology. I've been in practice for over 20 years, and this system of applied kinesiology, or AK as we like to call it, continues to be the keystone of my practice. In this video, I'm going to talk about what applied kinesiology is and show you how it works. AK was conceived in 1964 by Dr. George Goodhart. Dr. Goodhart resolved a long-term shoulder problem by correcting a weak muscle. This led him to further investigate the relationship of muscle function to other health problems. What is AK? Simply put, it is the use of manual muscle testing to evaluate your body's health through the function of the nerves, muscles, and bones. So how do we test the muscle? The actual muscle test is both an art and a science. It can take many hundreds of hours of training and practice to become an accurate muscle tester. The muscle test is like a stethoscope. It is only an effective tool if the person using it knows what to listen for and how to interpret the findings. The muscle is set up by the doctor. While the patient resists, the doctor pushes in line with a precise vector specific to that muscle. We are not testing the overall strength of the muscle. We are testing whether the muscle's nerve motor control is on or off. We use the example, we are not testing whether the light bulb is a 50 watt or 100 watt. We are testing whether the switch is on or off. When you have a weak muscle, it may be due to a local cause or a more remote cause. The muscle could be damaged and your body is turning off the signal to protect it. Or it could be weak due to other factors more remote to the muscle. We call these factors the 5 factors. These are spinal alignment, blood flow, lymph flow, cerebral spinal fluid flow, and acupuncture meridian flow. When you come into my clinic, how will I use the system of applied kinesiology to help you? We already mentioned how Dr. Goodhart resolved a chronic shoulder problem by fixing a weak muscle. Suppose you have chronic daily neck pain and stiffness. You have had massage therapy, physical therapy, acupuncture, and chiropractic adjustments with only temporary relief. The first thing we do is get the story from you about this problem up until now. We start with standard exams and then combine those results with our applied kinesiology results. Here are some basic ideas about muscle function. Muscles turn on, muscles turn off. Muscles move bones, muscles stabilize bones. Muscles only do what the nerves tell them to do. This is a visual example of what could happen if one muscle in a group turns off. The washer in the middle is the bone, and the rubber bands are the muscles. As the muscles contract and relax during normal movement, the washer maintains its position suspended from the muscles. If one of these muscles turns off, you can see how the bone now moves out of place. Once we find a weak muscle, we then use our system of applied kinesiology to find the cause of the weakness. In this video, I'm going to show you how to use the system of applied kinesiology to diagnose, supply, and observe, DSO. We have already performed the standard tests, which were all negative, and we now can safely use AK testing to get more information.